This employee orientation session is intended to introduce you to Sully Home Care and provide information about the agency, the organizational structure, the services we provide, and the expectations needed to begin a successful working relationship. During this session, we will review agency contact information, the systems we use, the documents in front of you, and at the end, you will have the opportunity to ask questions. Welcome to Sully Home Care. We hope that your employment with this agency will be rewarding. Sully Home Care complies with all federal and employment laws and with applicable local laws. Sully Home Care is committed to the principles of equal employment, and it is our intent to maintain a work environment that is free of harassment and/or discrimination or retaliation based on all the protected classes. Your employment with Sully Home Care is on an at-will basis. This means that your employment may be terminated at any time with or without notice and with or without cause. Likewise, we respect your right to leave the agency at any time with or without notice and with or without cause. Sully Home Care was founded in Randolph, Massachusetts by Osman Sully for the purpose of providing in-home care to vulnerable and elderly clients in their home and non-emergency transportation services for medical appointments. Sully Home Care is committed to fostering an inclusive environment that honors the diverse cultural background, traditions, and beliefs of our clients and staff. Services are provided in the South Shore, North Shore, Boston, and Greater Boston area. The governing body of Sully Home Care is comprised of the three owners, the executive director, the director of nursing, one physician consultant, representatives from the community, and consumers. More specifically, the organizational chart falls like this. Mr. Osman Sully is President and CEO. Mr. Hudson Talusma is Vice President. Ms. Frislin Guillaume is our registered nurse and clinical director. My name is Marilyn Sully, and I'm the Human Resources Director. In support of the agency's philosophy, employees will be dedicated to the provision of comprehensive quality care, which is client-centered and client-family-centered, provided in the client's place of residence. Our care approach focuses on the whole person. Services are designed to meet each client's unique medical needs while ensuring safety, supporting psychological well-being, maintaining dignity and self-esteem, and encouraging independence and personal fulfillment. The agency is committed to the provision of home health services that assist the client to search for meaning in the personal life experiences surrounding the client's illness or disability. Clients and families are encouraged to collaborate activity with agency staff and other healthcare providers regarding the provision of appropriate services. Education to the client's family, and the community of health-related issues is also part of the agency's philosophy. Sully Home Care is committed to providing a safe, individualized, quality, compassionate home and community-based healthcare service that enhances the quality of life and independence of those we serve in the comfort and security of their home. The agency is committed to a safe and client-centered practice in all its services. Our objectives are to ensure that all clients are provided with quality, comprehensive healthcare services through a coordinated plan of care, to provide continuity of healthcare to facilitate uninterrupted Sully Home Care meets Our philosophy and mission are aligned to ensure we provide culturally competent care. Culturally competent home health care involves recognizing, respecting, and integrating Sully Home Care provides respectful care that recognizes individual differences in race, ethnicity, language, faith, and ability, and ensures that every client feels understood and respected as they receive services in their home. Sully Home Care provides the following services. Now that we've gone over the basics as it relates to clients and services, let's discuss what is expected for employees. From this point forward, employees refers to employees and contractors. Sully Home Care believes that the employer-employee working relationship begins the moment the application is completed and submitted. It is our expectation that employees will complete all pre-hire qualification and documentation requirements in a timely manner, complete and maintain ongoing training requirements, such as monthly and annually requirements, CPR, in-service, and other skills training and medical requirements. Use agency tools or systems as trained and required to meet Massachusetts requirements. The employee work performance will be evaluated on a 90-day and annual timeline. Depending on financial health and other agency factors, efforts will be made to give pay raises consistent with agency profitability, job performance, and meeting compliance requirements. Employee grievances will be addressed in a fair and equal manner through the proper chains of command. Employees with a grievance should discuss the problem with their immediate supervisor, and the supervisor should then give a response on the grievance within 5 days. Grievances not raised within 5 days will be considered waived. Employees are expected to maintain a professional demeanor as they work and in their communication. They're expected to arrive on time and follow the schedules provided. They are expected to show up for all accepted shifts. They're expected to treat clients and other employees with dignity and respect. And they're expected to follow the care plans and agency policies. Failure to meet these expectations at any stage of the hiring or onboarding process may impact eligibility for employment or continued engagement with Sully Home Care. Now that we've provided an overview of the agency and the employer expectations, let's begin to review the documents that are in front of you. Please note that you will be required to print your name, provide your initials and/or signature, and answer the question on each of the documents. As we review each document, you are encouraged to make a note of anything that you do not understand or those that require more of an explanation. At the end of this presentation, you will have the opportunity to ask questions and receive additional information or training if needed. HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act, and is a rule that was established in 1996. HIPAA sets strict standards for managing, discussing, sharing, and saving protected health information. Protected health information includes client past, present, or future medical or mental condition, the provision of health care to a client, or the past, present, or future payments related to the provision of health care for the client. Your signature on the HIPAA agreement and your successful completion of the HIPAA exam confirms your understanding of this rule and your agreement to treat client information confidentially. In summary, HIPAA compliance ensures that clients' protected information should be treated confidentially and must only be shared with those who need to know. Violations of HIPAA may result in civil and/or criminal penalties. In-service trainings. Sully Home Care has partnered with Care Academy, an online training program, to help you improve and maintain your caregiving skills on an ongoing basis. Employees are enrolled in Care Academy at the start of hire and are sent a welcome email message directing them to create a profile. Reminders are sent monthly and training must be completed annually. All direct care and office staff are required to complete the initial in-service training through Care Academy within 1 week of hire. Completion of this training will be verified through certification. Employees who complete the required training within the specified time frame will be paid for the training during the first payroll cycle following completion and their hire date. All direct care and office staff are also required to complete ongoing in-service training to maintain regulatory standards. Completion of these mandatory trainings is required as a condition of employment. While this ongoing training is not necessarily compensated, successful completion will be considered as part of annual performance and rate increase evaluations. Employees who receive training through other providers must send copies of the training certificates to HR to maintain compliance. Now that we've mentioned Care Academy, let's take a moment to ensure you are set up and know how to get to your Care Academy profile. Take out your mobile devices, go to your messaging service, and check your email for a message from Care Academy to set up your password. If you did not receive an email, don't worry. Option 2, go to your search browser and search for go.careacademy.com. Log in and then enter your email address or mobile number as your new username. Next, follow the steps to create a user ID and password. I recommend you save your password. Finally, make sure you check your emails every month for reminders of the next training assignment to stay in compliance of this annual requirement. If you have difficulty completing these steps, help is available on Care Academy's website. If you're logging in for the first time, click How do I set up my password for the first time? If you have forgotten your password, click I forgot my password. What do I do? You may also go to www.careacademy.com and click on Login on the upper right-hand side of the screen. You'll be directed to the sign-in page shown here on the right. Hopefully you've successfully completed your Care Academy setup. Let's move along to the next page. Employees' trainings in Care Academy will be tracked, and files will be updated to ensure training is completed as required. In-service topics are noted on the in-service document, and additional trainings are available if needed. Sully Home Care also sends messages through the Care Academy text messaging system, offering newly available shifts or other important information. Make note of the Care Academy number, 877-846-1483, to accept new shifts or acknowledge messages from the agency. Responses to this text message are not monitored. If you have questions, you must contact the office by phone or email. Moving right along, let's talk about employee medical information. The first document in this section is the Employee Health Questionnaire. Employees are conditionally hired by Sully Home Care to deliver services to clients. Services vary according to the needs and care plan of each client. Employees are required to perform duties of a physical nature, which have physical demand requirements. The health questionnaire is used to obtain information about the employee's ability to perform these tasks. In addition to completing the employee health questionnaire, employees are required to provide a copy of their physical within the recent 12-month period and a copy of their TB test or chest X-ray. Employees must also complete a TB questionnaire and TB risk assessment form. Physicals and TB questionnaires must be updated and provided to HR annually. Employees must make every effort to schedule appointments with their healthcare providers annually to meet this mandatory requirement. In some cases, it may be difficult to make an appointment with your healthcare provider. In those cases, notify HR of the delay, and we will make note of the appointment date to ensure compliance is still met. The HBV waiver form. HBV is a highly contagious virus that infects the liver. HBV spreads through infected blood or other bodily fluids. Employees who provide home care are at increased risk of exposure to HBV and must be notified that there is a vaccine to limit exposure. Sully Home Care does not provide the vaccine. Employees are notified that they can choose to decline the vaccine, or they can choose to get the vaccine from a provider of their choice. Employees who choose to or have already received the vaccine must notify the agency of the dates the vaccination was administered. Vaccination is provided in 3 doses. Moving right along, let's talk about the employee offer letter, job description, and benefits. Each employee receives an offer and signs an offer letter based on their specific experience and job description. Employees sign a job acceptance statement and job description that describes the functions associated with their role. They also sign an alternative dispute resolution stating that any dispute between the employee and the agency will be resolved through mediation. Employees are paid biweekly by direct deposit, and the work week is Wednesday through Thursday. All offers of employment are on a part-time basis and may be switched to full-time after successfully completing the 90-day probationary period. Health benefits, which include medical, vision, dental, and 401k, are available to all full-time employees who consistently work a minimum of 30 hours weekly and elect to participate in the benefits program. Sully Home Care policy is that direct care staff do not earn paid vacation time. Sully Home Care offers paid sick time in accordance with Massachusetts laws as follows. 1 hour is earned for every 30 hours worked, for a total of 40 hours or 5 sick days annually. Sick time usage begins after 90 days of employment. Sick time is available for employees who are sick or need to attend appointments for themselves, a child, or a close family member. Sick time does not roll over and cannot be used until earned and is not paid out if not used. Employees must notify their supervisor or HR in writing as early as possible of the sick time they would like to use and the date of use. Sully Home Care works with Paychex as their payroll provider. Employees are enrolled in Paychex Flex at the start of employment and must create an account to set up their direct deposit. Direct deposit accounts set up by HR or payroll must be approved by the employee in Paychex Flex before the payroll cycle closes, or direct deposits will not be processed. The Paychex Flex app is also where the employee handbook, payroll calendar, and other documents can be found. Let's take a moment to ensure you are set up and know how to get to your Paychex profile. Pull out your phone and check your email for a message from Paychex to set up your password. If you did not receive an email, don't worry. Looking at your phone, go to your search browser of choice and search for and click Paychex Flex login at www.paychex.com. Once there, click Sign Up. You should be looking for a Paychex page similar to what is posted here on the right. On the About You screen, fill in your personal information and click Continue. Next, create your username and password. Then click Continue. Be sure to select a username and password that you will remember. I would also recommend saving it to your phone for easy signing. Next, on the Login Details page, set up your security questions. Choose your security level and check the box, I acknowledge I have read and understand the security levels. Click Continue. Next, to complete the registration, a one-time verification code will be sent to the email address on file. Open the email to find and enter the verification code. Once these steps have been completed, your account has been created and is available to log in. To review the employee handbook and other documents, select the menu on the top left and go to My Documents. Now let's review some payroll policies. All Sully Home Care employees are enrolled in Paychex at the time of hire and receive an email invitation from Paychex Flex requiring them to create a profile. Paychex profiles allow employees to view and verify that their payroll information is correct and also gives them access to their pay stubs, direct deposit, end-of-year tax documents, the employer handbook, and the employee documents. The Paychex app also allows eligible employees to enroll in health care benefits and 401k when they become available. Payroll is processed bi-weekly, and employees whose hours are not completed or verified in time will experience delays. It is each employee's responsibility to notify the agency of address changes as soon as they occur. Now back to the documents. Next up, Fields Practices Statement. Each employee signs a Fields Practices Statement that outlines the agency's standards and procedures. Violations of any standard may be grounds for immediate termination. Let's review. The employee will carry out the duties and responsibilities listed in the job description, client's plan of care, or list of assigned tasks. All employees are expected to dress in a manner appropriate to the healthcare environment and always wear an ID. Scrubs are not required. This includes personal hygiene, jewelry, hair, and makeup. Employees are expected to arrive on time to all assignments they have accepted. If an emergency or any situation should cause you to be late or absent, you must notify the agency immediately. Do not call the client. A no-call, no-show is grounds for termination. If the client asks you to stay longer, leave earlier, or change the schedule, you must call the agency immediately for approval. Employees are required to clock in, out, according to the client's schedule, and to complete the visit notes within 24 hours of visit completion. While working with the client, do not discuss pay, company business, personal business, politics, or religion with the client. Do not remain in the home if the client is not present. Do not bring friends or relatives into the client's home. Do not perform additional duties for the client that are not part of the care plan. All contact with the client shall be only on scheduled agency time. Under no circumstances are you to ask for or accept money from the client or be involved in the client's financial affairs or to take home property that belongs to the client. Aides will not, under any condition, dispense or administer medication. Personal calls during visits shall be limited to emergency only. As an employee of the agency, you are not authorized to accept any direct employment that may be offered to you by the client or their family member. And let me stress, do not clock in or out or complete visit notes when the client is absent from the home or hospitalized. Doing so is considered fraud, which is subject to disciplinary action up to and including termination. Non-compete agreement. Sully Home Care employees may be in receipt of confidential agency information of a competitive nature and are prohibited from sharing or providing the information to anyone without the written consent of the CEO. Confidentiality of information agreement. All information designated as confidential will be treated in a confidential manner. All information gathered, maintained, or stored by the agency becomes the agency's property and cannot be released without proper authorization. Agency information cannot be altered without proper authorization. Conflict of interest. Employees of Sully Home Care may not derive any profit or gain directly or indirectly by association with Sully Home Care. Direct care staff understand that all clients are clients of the agency, not personal clients. Clients may never be serviced privately by an employee for the financial gain of the employee. Let's pause for a moment while I give you an example. Let's say that you are a good cook and you have a side business where you prepare and sell meals to people. You cannot, in your duties as a direct care staff of Sully Home Care, prepare and sell meals to the clients. Instances like this may create a situation where if the client becomes upset because of the meal that you sold them, they may mistake that act as being related to your role as an employee of Sully Home Care. We would never want to do anything that negatively reflects on the services that clients are receiving from the agency. Moving on. Corporate compliance statement. The corporate compliance statement commits the agency, its employees, and contractors to abide by all state and federal laws and regulations. The items listed on the form and the items defined below are a summary only. The Federal False Claims Act statement. The agency will not submit or cause to be submitted any false statements. Violators will face civil penalties of not less than $5,000 and not more than $10,000. This specific item will be addressed again a little later on in this orientation session. The Stark Bill. The Stark Bill prohibits physicians from referring clients to designated health services if there is a financial interest. State licensure requirements means that you must be in compliance with maintaining CPR, RN, LPN, or other licenses that require renewal or consistent training. And as stated during the beginning, we do comply with all federal, state, local, and civil rights laws. Tax filing forms. All staff must complete a tax withholding statement to instruct employers on state and/or federal income tax withholding based on filing status, dependents, and other income. Employees are encouraged to consult a tax preparer if there are any concerns about completing the form correctly. Special attention must be given in Step 2 and Step 3 to ensure you are making the correct selections. Direct deposit. Sully Home Care requires all employees to sign up for direct deposit. When completing the direct deposit form, write clearly and legibly. Errors on the form may result in deposits going into the wrong accounts. Direct deposit information can also be added in Paychex Flex. Direct deposit information entered by HR or payroll will require further review and approval by the employee. Disclaimer and waiver of liability. Employees acknowledge and agree to follow the rules and regulations as set forth by Sully Home Care and understand that falsification, particularly related to services provided and visit notes, is considered fraud. Falsification of documents related to the provision of services and visit notes is subject to disciplinary action up to and including termination. Health and safety agreement. Employees acknowledge the physical requirements of their job and understand proper lifting and moving techniques in moving objects and/or clients. Employees understand that any injury claimed while on the job must be immediately reported to the supervisor and documented on the accident incident report form. Following infection control agreement. Sully Home Care wants to improve patient outcomes by identifying and reducing the risk of infections in clients and agency staff. Employees must practice good hygiene and sanitation and notify the agency of any possible infections. The agency will document infections that are acquired while the client is receiving services from the agency. The document will include the following: the date the infection was detected, the client's name or number, primary diagnoses, signs and symptoms, types of infections, pathogens identified, and treatment. The infection control program will include surveillance, identification, prevention, control, and reporting. Employee handbook and review. This listing of policies shared in this section are only a summary. The complete employee handbook is available in the Paychex Flex app in My Documents. As we move through the employee handbook review, it is noted that I refers to each staff member participating in this orientation session. You, as a direct staff member, must review and provide your initials next to each statement. Now let's go. The undersigned hereby acknowledges review of Sully Home Care Employee Handbook and understands his or her obligation to read the handbook and comply with the policies described. That the policies are intended as a guideline only of the rights and obligations of employees and Sully Home Care, and that nothing in the policies should be read or is intended to create any type of binding obligation on the part of Sully Home Care, nor does it create any type of contract or agreement between Sully Home Care and employees. That all the terms and provisions of the handbook, including but not limited to the various benefits described in the policies, are subject to and may be changed, modified, amended, or eliminated in whole or in part at any time and at the sole discretion of Sully Home Care. That the Sully Home Care Employee Handbook is also available in Paychex Flex www.sully.com/mypersonalprofile/my-documents. Policies and Procedures Orientation Acknowledgement. The undersigned hereby acknowledges review of Sully Home Care policies and procedures and agrees to follow all guidelines, both written and verbal. I understand that if the guidelines, policies, and procedures are not followed, that I may be immediately terminated. I also had the opportunity to ask questions regarding the Policies and Procedures Manual, and I know where it's located for future reference. Employee Dress Code and PPE. Sully Home Care Services strives to present a professional and safe healthcare image to patients, families, the community, and other healthcare professionals, which includes wearing a name badge when providing patient care. Sully Home Care Services staff members will adhere to the standards of a professional image in their dress appearance. PPE for eyes, face, head, and extremities, protective shields, and barriers reduce the incidence of contamination. Sully Home Care Services provides protective equipment appropriate for the tasks being provided. Universal Precautions Training, Blood-Borne Infections, Exposure Control. Sully Home Care is committed to providing a safe and healthy environment for our employees and clients through education, current application of infection control practices, and implementation of appropriate safety. I have received training on blood-borne pathogens. I understand the material presented during the training and am aware of my responsibility to follow the safety protocols and procedures outlined. I will follow the guidelines to ensure my safety and the safety of others in the workplace. Sexual Harassment Policy Acknowledgement. The agency will not tolerate any form of sexual harassment from any of its employees. The agency encourages that any behavior which could be construed as sexual harassment be reported immediately to the supervisor and/or administrator. There is no need to fear retaliation. Both females and males can be sexually harassed when exposed to unwelcome sexual advances or to a pattern of verbal abuse, threatening, crude, impolite, or unprofessional conduct. Computer, password, electronic signature statements. Sully Home Care will maintain confidentiality and security of patient data that is entered into and stored on computer systems and mobile devices. I understand the need and responsibility to maintain a high level of security with computer or mobile device access. I will not allow anyone to use my computer or mobile device or key or password and accept full responsibility for the security of my computer or mobile device or key or password. I agree that my electronic signature is the legal equivalent of my manual or handwritten signature on agency documents. By selecting I agree using any device, means, or action, I consent to the legally binding terms and conditions of said document. Incident, accidents, changes in client health status. I have been thoroughly informed by this agency that I must report all incidents, accidents, and any medical, physical, or mental changes in my clients immediately to my supervisor and/or on-call personnel. I have been informed by the agency that I am required to report any changes to the client's status, changes in health, or hospitalization. I further understand that in the event that I become injured, even a minor injury, I am required to report that incident to HR as soon as possible after an injury. Reporting abuse, neglect, and exploitation. All agency staff are required to report suspected abuse, neglect, exploitation, and develop a plan to minimize the risk of such. The home health employee is responsible for reporting and documenting all incidents to DON and/or supervisor or an appropriate designee. Access mobile app, clocking in and out, visit notes, EVV verification. The Access mobile app is required to clock in and clock out of client visits and to complete visit notes within 24 hours on completion of services provided. Correct and timely use of the mobile app verifies that services have been provided according to the client's prepared schedule and ensures accurate billing and payroll. I fully understand that use of the Access mobile application is a requirement for electronic visit note completion and verification of services provided. I have been trained on the clock in, out, visit note completion, submission, and verification process. I understand that my Access clock in and clock out also confirms the amount of hours I am scheduled to work and should be paid. Failure to clock in and clock out correctly will affect my paycheck, and continued failure to clock in and clock out will lead to disciplinary action up to and including dismissal. I understand that visit note completion verifies the services provided. Visits falsely marked as completed are considered fraudulent and may result in corrective action up to and including dismissal. I understand that if I am unable to complete my clock in out because of technical issues, I must contact the agency at the beginning and end of my shift, no more than 15 minutes after the start of my scheduled shift, or no later than 15 minutes after my shift ends, during business hours at 508-510-6963, and during non-business hours, or at 857-261-4343, which is the scheduling on-call phone. In-Services Training and Care Academy. Sully Home Care has partnered with Care Academy, an online training program, to help me improve and maintain my caregiving skills as part of my continuing education requirement. Topics covered meet the state of Massachusetts annual training requirements for respective caregiver roles, and additional training may be assigned. All Sully Home Care employees are enrolled in Care Academy at the start of hire, and I fully understand that use of Care Academy is required as part of my initial and annual continuing education requirement. Employee annual compliance requirements. I fully understand that as a condition of my continued employment with Sully Home Care, I am required to provide the following at time of hire and provide annual updates. Recent physicals, plus immunizations with TB tests and chest x-rays and TB questionnaires. Valid CPR certificates demonstrating hands-on training, CNA certificates, or nurses' licenses. Cellular phone use. All Sully Home Care staff are strongly cautioned that they should not be on their phones during work hours. If while working you need to respond to an urgent call or text, do so quickly and then return to work responsibilities as soon as possible. Also, Sully Home Care Services does not permit employees on company time to talk on any cellular phones while driving a vehicle. This is very dangerous and should be avoided. It is mandatory that I pull over and stop my vehicle each time I conduct agency business by cellular phone. I also acknowledge that Massachusetts is a hands-free state and I must operate my vehicle safely and abide by the hands-free laws. Massachusetts EVV requirements. Electronic visit verification, EVV, is required for home care services. Sully Home Care uses Access for EVV. Employees must clock in when they arrive at the client's home and clock out when the visit is completed. Ensure visit location and time are accurate. Complete visit notes within 24 hours of visit completion. EVV protects both employees and clients by verifying services provided. Access System Overview. Please take note of the two access systems at the top of the page, commonly referred to Blue Access, Home Care, or Red Access, Home Health. Employees will be added to Blue Access or Red Access. Sully Home Care uses the Access system for scheduling. Schedules are created in Access based on the service to be provided. It is critical that employees follow the schedule as created in Access. All EVV records must include the member who received the service, the provider employee who delivered the service, the specific service provided, the location of service delivery, service date, and beginning and end times of service. EVV records confirm the number of hours that are scheduled and that will be paid. Employees who do not accurately complete the clock in, out, and visit notes, or who fail to complete them on time, will only be paid for what can be verified within the current pay cycle. Employees are enrolled in Access when employment is extended and are automatically sent an email requiring them to download the app and create a profile. If you haven't already been trained on Access, check your email to confirm receipt of this welcome message. Once the Access profile is created, employees must upload an electronic ID. ID pictures must meet standard professional guidelines and clearly identify each employee. To upload a picture, go to the menu and select Electronic ID Badge. The electronic ID will be used to create a physical ID. Things to note while logged into your profile. The main office number, 508-510-6963. When calling the office, make sure to listen to the recording and select the correct department to leave a message. Please note that this is a landline and cannot receive text messages. Fax. The fax number is primarily used for internal purposes, but you can also make a note if for some reason you need to fax something to us. Scheduling on-call number. The scheduling on-call number is 857-261-4343. This number is available for use during non-business hours for issues related to schedules and to communicate error messages received while trying to log in and out of Access. Access mobile app use and training continued. Access instructions. A. Create a password that is at least 8 characters long. Make sure it's something you can remember. B. Create a 4-digit passcode that is different from your password. C. Select the correct client. Then select Clock In. Lock your phone and start your visit. D. When your shift is over, reopen Access and follow Step C, selecting the correct client again. Then select Clock Out. E. Have your client check the boxes, sign, and select Submit twice. F. Complete your visit note by selecting Daily Living Task. G. Select Yes for each task completed, then select Complete. Finally, sign and date your visit. Confirm that this information has been captured as entered. If you have any questions about whether or not the visit has been seen and correctly documented, contact the office during business hours. Communication with the office. Employees experience issues with clock in and clock out must notify the agency immediately and no more than 15 minutes after the start and/or end time. Employees must report schedule conflicts immediately so coverage is confirmed and/or adjustments are made, and must contact the office if a client cancels or requests schedule changes. We understand that work duties do not allow employees to read emails, respond to texts, or make or answer phone calls as easily as someone who works in an office. Sully Home Care uses your email provided in Access to communicate HR or other employee-specific information and text messages from 877-846-1483, the Care Academy number, to offer newly available shifts or to share important agency information. It is each employee's sole responsibility to ensure that they check emails and text messages regularly to ensure they remain up to date on compliance or agency-related information. It is also each employee's sole responsibility to make sure to update the office with address changes or phone number changes. Next steps and questions. If you haven't already done so, you will now be trained on how to use Access. If you have any questions related to your employment, benefits, or agency policies and procedures, direct them to me, the HR Director, at msully@sullyhomecare.com. Questions related to the clients or their services should be directed to the clinical team or the nurse. Questions related to scheduling should be directed to the scheduling team. Thank you for participating in this orientation session. You will receive payment for this session once you have completed your initial training in Care Academy. You will have up to 1 week from today's date to complete that training, and payment will be available in the payroll cycle immediately following your first visit and upon completion and verification that the training was done. Thank you again for joining Sully Home Care. Questions?